Hey everyone, and welcome back to the channel. Today we're diving deep into the world of health insurance, specifically the ever-present debate, HMO versus PPO. Choosing the right plan can feel like deciphering ancient hieroglyphics. But fear not, health detectives. HMO, the neighborhood doc. Imagine a cozy healthcare community. Your friendly neighborhood doctor knows you by name, and specialists are just a referral away. That's the HMO experience. HMO stands for Health Maintenance Organization, and it's all about keeping costs down through a limited network of doctors and hospitals. Think of it like your local gym membership. You only get access to the equipment inside. Pros of HMO: lower monthly premiums. HMOs are generally cheaper than PPOs because they negotiate lower rates with in-network providers. Strong emphasis on preventive care. Regular checkups and screenings are often covered with little to no cost, helping you stay healthy and potentially avoid more expensive treatments down the line. Continuity of care. Building a relationship with your primary care physician, PCP, can lead to better overall health outcomes. Cons of HMO: limited network. You're basically stuck with the doctors and hospitals within the HMO network. Seeing an out-of-network provider usually means paying significantly more, unless it's an emergency. Referrals required. Most HMOs require a referral from your PCP to see a specialist, which can add an extra step to getting the care you need. Less flexibility. If you like having options and trying different doctors, an HMO might feel restrictive. PPO, the open road. Now picture a wide open highway with healthcare options galore. That's the PPO world. PPO stands for Preferred Provider Organization, and it gives you more freedom to choose doctors and hospitals, both in and out of your network. Think of it like a travel pass that lets you explore different gyms with a price tag depending on how far you venture. Pros of PPO: greater flexibility. You have the freedom to choose any doctor or hospital, with in-network providers offering lower costs and out-of-network covered at a higher percentage. No referrals needed. You can skip the referral step and see specialists directly if you prefer. Peace of mind. Knowing you have options can be reassuring, especially if you have a specific healthcare need or live in an area with limited HMO choices. Cons of PPO: higher monthly premiums. PPOs generally cost more than HMOs because of the increased flexibility they offer. Higher out-of-pocket costs. Using out-of-network providers typically comes with higher deductibles and co-pays. Potentially less emphasis on preventive care. Preventive care may not be as heavily covered as with HMOs. The verdict: it's personal. Choosing between an HMO and PPO is a personal decision. Consider your budget, health needs, and preferred level of flexibility. If you're on a tight budget and like the idea of a close-knit healthcare community, an HMO might be a good fit. But if you value choice and the freedom to see any doctor, a PPO could be the way to go. Remember, do your research, compare plans and network options before making a decision. Talk to your doctor. They can help you understand your health needs and recommend the best plan for you. Don't be afraid to switch. If your needs change, you can always switch plans during open enrollment. That's it, folks. Hopefully, you're now equipped to navigate the HMO versus PPO maze with confidence. Remember, the right plan is the one that keeps you healthy and happy. Like and subscribe for more health-savvy videos. And as always, if you have any questions, drop them in the comments below. Until next time, stay healthy and informed.